Thank you so much. Congratulations. And now for the special panel discussion that we have planned, which was, the film really touches upon so many points, and I'm sure all of us are keen to hear different perspectives and hear some of our experts speak. So I'd like to invite three special guests who have joined us here today. Zia Nath. She has been a biodynamic craniosacral practitioner for 17 years. Sufi whirling is also her passion. She works with birth trauma, among various other conditions. Please come up on stage, Zia. Dr. Suchetan Pradhan. He's an implantologist and has over 27 years of pioneering experience in laser dentistry, and we've all seen him in the film as well. Welcome, Dr. Suchetan. Our third panelist is Dr. Amit Dhurandhar. He's an obstetrician and gynecologist, and he's among the first few obstetricians in India to conduct water births and hydrobirths for natural pain management during labor. Of course, Yasmin will be joining us on the panel as well. When we start, we'll call her up. Mics. And considering I'm asking the question, I get to hold one. Yeah? Okay. So, the film really touched upon a lot of diverse issues. And in fact, the first time I saw it, I was just very overwhelmed with the diverse range of topics covered. We started with just the idea of breastfeeding, the grief associated with the absence of it, all the way to tongue ties and to dealing with that. So it's quite amazing that in 59 minutes you managed to cover so much ground. So my first question is actually to you, Zia, that we speak about grief associated with miscarriage, stillbirth, and postpartum depression. But why is the grief associated with loss of breastfeeding not spoken about? And how can cranial work support postpartum depression and grief?
Because of modernization with milk alternatives to breastfeeding, I think that's a big reason that's not considered a big deal, because when a woman is not able to breastfeed, formula comes in really so quickly, and along with the message that you did not have sufficient milk, or your body's not doing good enough, your milk is not good enough, this has got a lot more, formula is packed with a lot more nutrients, it's good for your baby. So a lot of women who are not able to breastfeed and are moving on to formula are also thinking that they're giving the baby a better option. And though in their body, physiologically, there is a huge breach in the hormonal development when breastfeeding suddenly stops. So they may experience, hormonal dips, thyroid, or other imbalances in the autonomic nervous system, which they may not necessarily relate to the loss of breastfeeding. But often they're not thinking about it this is, I lost something. They're thinking that I'm doing something better for my baby.
So I like Zia to actually bring that forward about, if you watch in the film, most of the women who spoke about how their loss was when they were not able to breastfeed, you notice that they actually had a smirk and a laugh. And sometimes you wonder, why would somebody actually have a smirk and a laugh when they're trying to share something that's so intimate for them and there's a loss to it? And this, what I call, is a disassociation. It's a bodily function that does not allow us to be able to, if we cannot handle a certain kind of trauma, then the body actually fragments that experience, and then it takes us away from it because we just can't handle that. Can I ask Zia to actually elaborate that, a sense of disassociation in the body, and how is that as a mechanism in the body that protects our sense of who we are as people?
It's a survival coping mechanism. We respond to stress through fight, flight, freeze, dissociation. These are, some ways that we're responding to survival. And when something traumatic happens that is not necessarily physically injurious or physically that you can visibly see a loss, but that's something deeper within, we're not always in touch with our deeper emotions. Also, the kind of society that we're living in is not encouraging us to, on a daily basis, move deeper and see, okay, what is happening here? Sometimes I also see, in society that is not well off, they really don't have the luxury to to grieve. They don't have the time for it. And they just have to move on really fast and cope. And that's typically when dissociation can happen. You just put it somewhere behind you and you move on. So you're functional fully, physiologically, but something inside the system's caught, held, and moved back. That creates a breach in the circulation of your system, in the awareness of how you live life, in relationship with the world around you, and the sensitivity that you build towards yourself, and emotions that you're sharing with loved ones around you. So a lot of people with trauma that they cannot deal with face to face, really face it, will deal with it through dissociation. It's an easier way to handle that.
Would you like Isha to come up now, share?
Yeah, I think so.
So we have a mother to share a first-hand experience. Isha, can
Come
we
on,
invite
Isha.
you?
Yes.
I'd like us all to give her a big round of applause. It's really brave to be able to stand up and speak about yourself.
She has a exclusively fed baby at home, and she fed the baby. The baby went in the car. Come, Isha.
No, should I, do you want to sit down?
I like you to share your experience.
Okay. Okay. Hi guys. So I have a 7-month baby at home, and I'm kind of emotional after watching this film because I relate to a lot of what happened, because a lot of it happened to me, and I've had both Zia and Yasmin and Dr. Pradhan to thank for being here. So if there's tears, don't worry, they're happy tears now, because this is bringing back memories that are way back now, so it's fine. So basically, I mean, I think this, the main thing that I would like to share is that the lack of support that you get as a new mom. Like, I mean, I wanted to do the whole natural parenting. I'm vegan, and I was very clear. I know about how good breastfeeding is for you, and I know that, I knew about this when I was pregnant, and I knew that I would never give my baby any formula. I didn't even have it as a backup for myself. And then when I got to the hospital and things just started happening one after the other, like they said, when you have an induced labor, which they don't tell you about, and then one thing happens after the other, you need an epidural because you can't handle those contractions. Your baby is about to come out, he's crowning, but they're like, you need to have an intervention, whether it's forceps or I had a vacuum. And so I didn't have the 100% natural birth that I wanted. And then on top of that, I insisted on having my baby on me skin to skin within the first hour. He was breastfeeding. It wasn't the most comfortable thing. When I spoke to my doctors and the pediatrician and the nurses at the hospital, they said it's fine. The baby and the mom will adjust and figure it out over the next few days. So it all starts off with support, is what I would say, because as much as you might want to read and you think that you know what you're getting in for, like, I think childbirth and having a baby it just completely throws you off. And so you need the right support and guidance to just reassure you that, I was always like, I was going to be this fierce mom who is going to take care of her baby, and I don't need anyone else to tell me what to do, because I should know instinctively this is what I need to do. But when it comes down to it, I do need the reassurance. I need the support. And I found that from the hospital itself, I wasn't getting it. And I wasn't getting what I wanted. And, they start the top-up feeds there, which I'd insisted that I didn't want to do because I wanted to exclusively breastfeed. But I had so much pain. It was like my baby was biting on my breast, and I would literally look at him and be like, dude, what the hell are you doing? And throw him off me half the time. My husband would just be like, what's wrong with you? Just don't breastfeed. There's formula as a backup, which is what everyone else would tell me, that, we live in today's generation where you have an option. It's not like anything bad is going to happen to your child. Half the world is brought up on formula. But I was so determined to figure it out and to figure out this thing between us that was not going right. And I had, 6 lactation consultants, 3 pediatricians look at my child, and nobody could figure out what was going on. Nobody had an answer. It wasn't about a certain position or a certain latch or none of that. It just wasn't working for me, and my child was just not satisfied either. So And then, so I met Yasmin actually early on. I met her in the first week of having a baby. And I mean, to be honest, I found her too radical. So I said, I can't go back to this person because she just told me to be skin to skin naked with my baby and be locked up for 24 hours with him. And I said, this sounds ridiculous. Like, I can't do that. And she said, nothing's wrong with your baby. He's fine. You're fine. You'll figure it out. But then I went back to her 3 weeks after that. So my baby was 4 weeks old. And she spent some time, and in between that, I had Zia helping me out with craniosacral to just balance myself, my baby, do some body work, try and see if we could improve the latch, but things weren't working. So when I went back to Yasmin, she identified the phase 4 tongue tie, which is really difficult to spot, and I had shown it. I had asked my pediatrician and a few other people to help me out with this issue and to see, hey, did my baby have a tongue tie? But they all said no, and there's no such thing as a tongue tie, is what I was told. It's a fad going around in circles, in these lactation circles. It's not. It's like completely something to dismiss. And so when I went to Yasmin and she said, your baby has a tongue tie, and then I researched how we're supposed to get rid of this tongue tie, and to have a 4-week-old baby, and to do a procedure on him, I wasn't most thrilled about it, but if that would mean restoring breastfeeding for me, because that was my priority, I said, I'm going to do whatever it takes. So within 2 days, I convinced my family, my in-laws, my husband, everyone, that this is something we need to do. So we went to Dr. Pradhan and with Yasmin there, and we got the procedure done. And within 48 hours, my baby was breastfeeding really well, and I was within, I would say 10 days, it was 100% restored. So he was 80% better in 48 hours and 100% restored. And, the emotions that you go through as a new mom, firstly, what your body goes through from childbirth is painful enough, but then not being able to feed your child, you feel like a failure, honestly. And just because you don't have the option to do it, I feel like if I chose to give my child formula, and I don't judge anyone who does, it's fine because it's an option. But when you don't have the option to, and your child is crying there, looking for milk, and you have it. I was severely engorged because I wasn't able to give him my milk because it was too painful for me. And you have the milk, and you have a crying child there, but you just can't put 2 and 2 together. It's the most frustrating, and it just makes you feel awful. And I did go through some sort of depression, which I probably now realize it may have been because my body physically thought that I didn't have a baby because I wasn't able to feed in the middle for a bit because of the excruciating pain. But, and I think, it's just, even though you think you have the best support, I had nurses at home, I had the best doctors, I had my family who were all there for me. I don't feel like people just understood this need to get through this because it's not an essential. You have an option. Your child will survive. And often my nurses would tell me, after me having fed my baby for an hour, they would tell me, oh, the baby's still hungry. How are you not going to feed him? You have to give him a formula top-up, And so I would feel guilty as a new mom, being like, oh gosh, I don't have enough to give my baby, and he's going hungry. So all of these wrong associations that are being fed to you from day one, and as a new mother, you want to trust yourself. But when somebody who's supposed to be experienced is telling you otherwise, then you tend to doubt, And that doubt is what throws things off. And then you start going down a downward spiral. So I think that more than anything, you need people who are going to, sorry.
No.
Just give me a second.
Yeah, sure.
It's just bringing back the worst of times.
It's all over, isn't it?
I know.
Yeah.
He's totally fine now, and I'm totally fine now. And this is all in the past. So I feel like as a new mom, I wish I had a lot more support and a lot more just encouragement to be like, you can do what you want to do versus there's a backup. So it's not a big deal. So that understanding of the emotions, I'm not saying everyone is me and everyone wants to do this. But for people who do, I found it very difficult. It took me 4 weeks to find her and to find the support that I would need to get through this. And, I have friends abroad who, day one at the hospital, their babies are checked for tongue ties. If, just the kind of support that they receive with doulas and things like that, it's just easier, is what I believe. And so I just feel like there is a lot more that can be done here, and that should be. And I mean, having gone through this, I'm trying to spread the awareness of tongue ties because, I don't think that enough people know about it. And now that I've spoken to many friends about it, they feel they've gone through what I went through, but they weren't as perseverant, and their babies ended up just having formula, and now they're 3 years old, they have other issues, and they're considering maybe getting a procedure done. And if not, they still now at least understand why they were not able to breastfeed. So I think it's something really important that Yasmin's doing here. And the film is pretty much spot on from the beginning, from birth to what moms go through to the lack of support. And I just think that it's great. And I'd love to share the awareness that you're trying to spread in any way that I can. Thank you so much.
Thank you so much, Isha. Thank you for sharing that. So, taking off from what she shared, I have my next question for Dr. Amit. That, do you think there is lack of awareness and knowledge among medical practitioners around issues surrounding breastfeeding? And we saw that in the film as well. And as a doctor yourself, what are your thoughts about this?
Yeah, hi. First of all, I would like to congratulate Yasmin and her team for an incredible, hard-hitting film. It is spot on and very moving. Yes, breastfeeding awareness has to be raised even among medical practitioners. We don't know how much about breastfeeding. What I do is I work closely with doulas and midwives. So I make it a point when a mother comes to me, I introduce them to the doula or the midwife, whoever they choose, and they hold antenatal, prenatal classes for them, and I insist on them taking at least 4 to 6 sessions on breastfeeding, because breastfeeding is natural and normal, but it's very, very tough and difficult. We do not. We take it for granted, all of us, including the practitioners, take it for granted that it's a natural, normal process. Yes, it is, but it is very, very difficult. So I do have talks about breastfeeding for medical faculties in my hospital where I work in. But it is, the awareness is not enough, because everyone, including me, had taken breastfeeding for granted till I had my first baby, and I saw the way my wife Karishma struggled, and I was shocked, and that's when I started doing my own research and learning about breastfeeding. And the golden hour, the first hour when the baby is born, is crucial. The mother, the baby has to be on the mother's breast. You have to have skin to skin, regardless of the C-section or not. And even after the delivery, I tell the parents that you please switch off your mobiles, no snaps. You need that 5, 6, 8, 10 hours alone with that baby. You have to have that quietness. It has to be, you have to have the connection, that bonding with the baby. Then only all the hormones start going. You have to let the baby smell you, hear your voice. And then only the bond increases, there is a connection, and then the hormones start riding. And that's when the ejection happens.
So, Dr. Durandar, I wanted to bring attention to what Isha was talking about, the fact that she had an induction and then the labor progressed quite unnaturally from what she was experiencing. So can you share with us this roller coaster ride that many women go through? And in your practice, you've seen that you're supporting women through pain management in other ways. Can you elaborate that a bit of why is it so important that you have this?
See, when you induce a patient, which if usually we induce it for a reason, right? But unfortunately, a lot of doctors are inducing patients for other reasons. Anyways, if once a mother is induced, then obviously we have to give them synthetic drugs and synthetic hormones, and you give synthetic hormones, your pain increases. Then to subside the pain, we have to offer an epidural. And you give an epidural, due to which the uterus relaxes, so there is less contraction. So we again give more pitocin, the synthetic hormone, which again increases the pain. So again we give epidural. So it's a ridiculously a vicious circle, due to which there's an entire hormonal imbalance in the body, due to which definitely affects the milk ejection, the milk production, because it's all hormone related. So the best way, obviously, would be to have a natural, normal birth without any aid of any external hormones like pitocin, like oxytocin. But see, labor is a natural process. And why is there pain? There's pain because there's a natural event. There's an event, major event happening in your body. That's why God, nature, or whatever it is, has made y'all in such a way, which is incredible actually, that you have this pain, so you do not have the baby while you're driving a car or you're cooking, or it tells you, your body's telling you that you go home, go to a safe environment. That's why there's pain. So because this pain is natural, you have the normal painkillers in your body, which are the endorphins, which kick in. But it takes some time for the endorphins to kick in. But for that to happen, you have to relax. Your body has to relax. So we have various methods for relaxation, for the endorphin to kick in, to neutralize the pain. One of them is water, immersion in water, which is incredible, because who doesn't like to jump in a hot tub, right? That's the best way, easiest way of relaxation. So once we put the mother in the water, we feel that the labor progresses so fast because the body just opens up. The mother is not fighting the pain anymore. She's in a very comfortable space, due to which all her good hormones, oxytocin, the prostaglandins, etc., kick in. Then also there is something known as hypnobirthing, hypnosis, which I have various people doing it for them, where hypnosis is nothing but a way of relaxation. So lots of mothers are taught, and the birthing partner is taught to work the body through the mind in ways of affirmation, visualization, etc. But the key, I feel, is to have a birthing partner in like a doula or a midwife. I insist on all my mothers to have a doula. I have a few doulas, and I insist because just especially for the first timers, like the primees, they have no clue what's happening, So a doula is someone who is like a guide. She will take you, hold your hand right from your first contraction till you finish breastfeeding. Because the key is, even after the baby is born, their job is not done. The major job is breastfeeding. So the doula or a midwife helps right through that. And as an obstetrician and a pediatrician, I'm afraid we are not trained enough to help assist breastfeeding. You need to have specialists, like lactation specialists.
Yeah, thank you, Dr. Dhirendra. So I just wanted to bring in Zia here a little bit, just to understand the biodynamic aspect of, how our body is journeys through birth, and how can other supportive work, as what he was talking about, the water birth and hypnosis, birthing process. What is the other things that we can involve during the birthing process that can be supported for women?
I really love to learn from nature and animals. And if you see animals birthing, mammals, cows, dogs, cats, horses, lions, tigers, they're all mammals. We're mammals, monkeys, primates. We have the same nervous system. And they just give birth. That's it. Nothing to it. And I'm always so inspired by that. I love to see that. It happened to be that while I was doing my research project in advanced craniosacral therapy, I had to do a paper, and I chose to do on natural birth and breastfeeding. And at the same time, I was going through my 9th month of pregnancy, and then natural birth, water birth, breastfeeding, all that, while I was studying it. So that timing was really good. But also my midwife had told me, just, when she was showing us movies as education, she showed us movies of animals giving birth. There was no trauma, there was no suffering, because it's already in the body. So that's apart from having all the other support system which we need because we've forgotten the instinct for birth. That's great. I also think it's nice to remind ourselves that this is an inherent intelligence. The baby knows how to birth itself. It's already got the blueprint design. The body knows how to birth itself. The blueprint design is already there without interference, like Dr. Amit was saying. The hormonal cocktail is, the body is bringing up all the various hormones one after another as the body is changing its functions from an adrenaline boost to in labor to production of endorphins for pain and an oxytocin for milk and bonding, all of that. The body is doing it on its own. And there's a lot of beauty in that, to just trust that my body already knows this. If we can come with that as the first thing and then reach out to see what else is available, I think that's a good starting point.
So you spoke about trust, and that makes me think that I want to ask Yasmin this question, that you've collaborated with professionals and medical professionals around the world for this film. And the one thing that struck me is this whole idea of the modern idea of not really trusting the mother, and us having everybody in society telling us something is wrong with us. Is this a very Indian thing? Because I know from personal experience that right from the security guard in my building to lady cleaning my house would have an opinion that bhook lagi hai usko, isliye ro raha hai, bhooka hai. And I'm like, I have been struggling with the last 1 hour and I think I've done a good job and I've fed him, but everybody has an opinion and everybody thinks that it is their prerogative to tell you that. Like, it's their job as a somebody in society to tell a young mother that you're not feeding your kid enough. So is this a very Indian problem, or is this a global issue?
I want to start out from the beauty of how they actually approach us and give us the advice, because everybody wants to own this passage of life.
Right.
You see, because they're coming from the place of wanting to support, which is well-meaning support, but that necessarily need not be the one that is supportive for how we feel about it, yes. Right? Like Isha was mentioning, they were doing the best they can, but not necessarily about how I was feeling, right? But if you look at the film, Preeti and I, it was an eye-opener for me, because when I was interviewing people from across the world, and these individuals that you hear, the experts that you hear speak here, almost about 17 of them are there, and they all belong to different cultures. And none of them are actually directly connected with each other. They all have their own body of work behind. And when they are speaking about the similar things that are set in their own cultures, variations could be there about how our culture looks at it versus what American culture or maybe a Japanese culture will look at it. But the fact that we don't trust our bodies anymore is almost universal. It's universal. And what seems to be starkly aware for me when I finished the film was that there is severe poverty of listening and acknowledgement, not just in birthing and breastfeeding, but I think across the board of everything that's there in healthcare and how we relate with each other. There seems to be the severe poverty of acknowledgement and listening. And that is what comes up in the film, and that was my understanding, my realization when I was speaking to people, Preeti. That's where it comes from, yeah.
No, and I personally think that the poverty of acknowledgement is not just in healthcare, it's in the world, right?
Yeah.
That's the world we live in.
I hear that.
Yes.
I'm remembering something that has left an indelible impression on me. We had I think it was 2007, we had our first Birth India conference. Dr. Amit was part of it. You were there. And as part of it was an international conference. We called birth experts from all over the world. We didn't have money to fund them. They funded themselves and came. And it was just so wonderful to have this community together first time. And we had this director of a hospital from a very faraway village somewhere in South India. I don't remember the details. But he came on stage and he spoke about, he came and said that you're all talking about hospitalization, medicalization, instrumentation, forceps, suction, and all the most amazing things that are coming up. And, everyone is talking like really high technology in birth, or the counter effect of it and the adversities of it and all of that. And he said, I want to tell you something. This is what happens in the village. There is a village across the river, and we have a small kind of makeshift hospital where we have a nurse or a doctor. And there was this lady in the village across the river who got into labor. By the time her husband reached us, got a boat, crossed the river, came, That doctor who was supposed to go was finishing his lunch. He then got onto the boat with the husband. And the boatman had disappeared. Then he came back. Then they crossed the river, went back. About 6 hours passed. They reached the woman's house. She had already given birth. She had cleaned the baby. She had cleaned the floor. The doctor came. She greeted him, made him a cup of tea, gave it to him. And then she said goodbye. And she did it alone at home, just by herself. She didn't know, she had to take care of it herself. She had no education. She never went to school. But she just knew what to do with her body. She was working at the farm with the cows, and she's seen this all her life. Nobody told her that you cannot give birth on your own. So she didn't have that knowledge from before. And I think that's really one of the most beautiful stories about trusting your body and knowing that birth belongs to you first.
So one thing that struck me when I saw the film, I'm sure everybody has seen Jaws, right? And in the movie Jaws, the shark actually makes its appearance exactly halfway through the film. And in Yasmin's film, the tongue tie appears at the 31st minute. So, Dr. Pradhan, we've been waiting to hear from you. And, we want to hear about, I think it was very nicely put in the film about how the pendulum sometimes swings on both extremes. And what have you seen about underdiagnosis, overdiagnosis of the tongue tie, of phrenolotomies, and what has your experience been on the efficacy? You've, of course, spoken in the film, but we'd love to hear more.
Yeah, so first of all, thank you for making me the intermission person. But I must congratulate Yasmin, for that was an absolutely brilliant, brilliant film. I think whatever has to be said about, untying is being untied here. So that's really commendable in the time span that you did. And I'm very happy to be a part of it, first of all. I must tell you, coming back to your question, it was when I started doing it for the first time, we as mainstream medical practitioners have always this fear that whatever new things that you do, it'll be considered esoteric, it'll be considered in the realms of fantasy, and also an additional revenue stream, which we don't need. In fact, somebody came and has even said this to me. You don't need another revenue stream. Yeah, this is a comment that I've got. In fact, the problem that we face today is how do we educate the medical professional to recognize the tongue tie? And we know that we have class 4 ties. There are 4 different classes of ties. And the class 4 tongue tie is really the most difficult to identify. Most people cannot identify it, one. And I'll tell you, I have a very well-known pediatrician who's referring me patients, but he's referring me at age 1+. He's not referring me when we should be doing the tongue ties at 2 weeks to 6 weeks, which is absolutely what now we know. When I first, going back to that era, about 6 years back? 7 years back, when she first came to me and said this. And because Larry told me, and because Larry was a friend, a colleague, and a respected friend and a researcher, and that's when I said, okay, I must give this some thought. Otherwise, I would have been part of that group of people who would have dismissed it out of sight. So and it would have been sad, because I think we have been able to help quite a few people, and Isha's was very nicely enunciated what actually happened in her life. But we have to, and I think all of you guys who are here at this point should be the ambassadors who will convince the medical fraternity. And we've tried our best. In fact, there have been instances when we've invited doctors to see the procedure. They have come, they have seen. Veni, vidi, but no vici.
But it's a religion, doctor. We should talk about that.
It's
a religion to either believe or not believe. It's not a body condition, but for some reason it's a religion that I don't believe in. I don't believe in natural birth. I don't believe in tongue ties. I don't believe in breastfeeding. So this apathy is something that we need to really think about, I think.
And the moment you release that posterior tie, and now we see it, and we know because of experience, now we know when it releases, you actually hear a pop. There is a facial release that happens, And we wait for that. Both of us are looking at each other because I don't do any procedures without Yasmin. Because I think that it's extremely imperative and important that there will be a surgical workup from her, intraoperative as well as postoperative. Without her, that procedure is not going to work. And I think, again, that should be conveyed and told to the people. Pediatric seminars should be held. And I think this is a very good medium because this can be shown at these conferences for a fee, I think. No, I'm just joking. But I think...
Give me back what I gave you. That sort of thing. But I think what's important is to look at when there are so many layers of issues that are around that. It's almost like if you're looking for a tongue tie, it's almost like looking for a needle in a haystack. You already have issues around birth. We don't understand what's natural birth. We don't trust that natural birth. And then we have multiple interventions that go on with it, which means that there are multiple compensations that a baby and a mother is already holding. And then you have to have a top-up of looking at, there are multiple other issues, which are structural issues such as tongue ties, which have long-term impacts across life. And Preeti mentioned earlier that my work here is to not just look at the initial impact of it, which is supposed to be the basic competency of a baby is to breastfeed. Now, if the baby cannot do that, the big question is why, and how can we restore that? From there on to looking at anxiety and depression, because I work with adults as well for across age, and I'm looking at a close link between anxiety and depression with tongue ties. Now, if you're ranging from not being able to breastfeed to about depression, it seems like a huge, humongous spectrum that we need to actually cross over to be able to get there. So the topic is very complex. It has multiple layers. So we need a team to be able to go forward and actually learn, research. I think one of the main intent of the film was actually to do education and research, to be able to jump into research, because it is an untapped place where people need to come in and actually get educated about and then understand it, do the assessment, rehab, then look at what are the different nuances of doing research behind it. And I'm looking forward to being able to collaborate with people who can allow me facilities where we can do regular checkups to see what is the incidence of tongue ties, because that itself is a controversy. We don't know. Brazil says 20%, Australia says 20%, 10.7%, UK is saying something else, and Indian literature says somewhere between 3 to 4%. Now, that's a range. And like Dr. Suchetan was talking about, it says that even babies with, forget the posterior ties, which are far more trickier to even find out. Babies who have a heart-shaped tongue tie, which is completely the tongue itself is completely tied down, even that doesn't have any impact on breastfeeding is what I get to hear. Now, in my logic, I don't understand how that is not going to be linked with how a baby is able to suck and swallow and breathe. So those impacts are what we are looking at. So it's a range. So I wanted to ask a question to Dr. Suchetan, because I think for me, what touched me about the work that he does is about the fact that first he said, I didn't see a tongue tie, and then he comes back and he says, I see a tongue tie. Now that crossover that he did was only possible because he was willing to listen to what I was trying to say. Now that I feel is a lifetime crossover. And I'm truly grateful for him in my entire life to be just appreciative of that little fact that he was willing to listen and to actually take a back foot. And in a way, some people could even think that he's going to have his integrity questioned, that one day he said there's a tongue tie and tomorrow he says there's no tongue tie. So he didn't look at that. And how many of us amongst our own professionals are willing to step back and say, okay, maybe I missed something, maybe I should learn something. Can I hear from you, Doc, about the fact that this is something that's lacking, and for each of us as professionals, this is a learning, and there's something to learn for me as well in this. So how do we see this? Where are we able to cross this over?
Okay, I mean, I don't know about others, but I can tell you that I think if you do something with very, very honestly, which is what I want to be all my life, then you will, if you have made or omitted to see something, which is probably what I did the first time when I saw, because I wasn't sure.
Yeah.
of what a tongue, but that was the first case that we actually tried doing 7 years back in our lives. And so I wasn't sure whether this is exactly a class 4 tie or not, because there were no classifications available at that point of time.
Yeah.
So we were actually groping in the dark, so to say. So first when I saw her, and I was like, oh, I can see a lip tie, but I'm not sure if that's a tongue tie.
Yeah.
And then I went back and I looked at all the, and there were hardly 2 or 3 articles that were written in papers that were written in the scientific journals. And I sat back and I said, Yasmin is a very reasonable individual, and she's so committed to this. There must be some reason for her to say this. So I went back and looked at the journals, and I said, oh, maybe this is it. So when she came back again and I examined her, I could feel a knot right at the base of the floor of the mouth, which is something that you don't actually look for.
Right.
So that's how it actually happened. And I said, yes, I think she has this. Let's try this. There are no repercussions to what we're going to be doing because we're using lasers. And again, Scott said something about lasers and scissors and obviously, but we know that lasers have a low-level laser effect, biomodulation, and therefore the healing potential. And we've seen that.
Yeah.
Is
and you like your
better.
sciencey tools, don't you? That's okay.
I love technology, so it works. It works well.
What are the other impacts, Zia, that can actually pull the floor of the mouth? Because you understand biomechanical aspect of the body and biodynamic aspect of the body. Can you enumerate some of the other conditions that actually can masquerade or show us like a mask that necessarily is not a tongue tie?
So I remember reading this information, and at that time, I was breastfeeding my baby. It was in Linda J. Smith's book, and it said, when a baby is breastfeeding, it is using 6 cranial nerves that move through 22 cranial bones, through 34 sutures, and 60 voluntary and involuntary muscles are involved in successful breastfeeding. Wow. That little baby, I'm looking at my baby and saying, she's doing all this? She doesn't know it, I don't know it. Wow. So when there is intervention in birth, or there is any kind of trauma, even a long labor, head stuck in the birth passage for a long time, compression on the cranial bone is soft, depending on where the compression could be, cranial-based compression, it can really distort the shape within or intracranial membranes within that can exert an internal pressure that may be pulling it backwards. So the different muscles and nerves that I use is, for the neck to move up, for the jaws to open, come down, for the tongue to latch on, for sucking, for sensing, for taste, to suck, swallow, breathe in a coordinated way. And there is so much involved in this part of the body to have that facilitated. So if anything is happening to the neck or the cranial base or one side of the temporal or on the frontal because of forceps or right here on top because of suction, this can really affect how the baby latches or not, can open its mouth or not, or even if it latches, can it suck, swallow, and breathe at the same time in a coordinated way. So there are so many different aspects, and to recognize this and allow the body to come back to its normal design, physiological, anatomical shape and state is really helpful for the baby.
Thank you so much.
Torticollis, that was something that I must say, I was so impressed with that one baby, that little baby who had a massive amounts of torticollis. And when we released that, immediately it was released. And we're both looking at each other and saying, oh, this is great. So, we don't even understand what it actually does. And I wish there could be a more sort of scientific approach to somebody funds a study that says, okay, what are the benefits of this actually? Long-term benefits. If somebody could do that, it'll be absolutely great. And also, I think that all the hospitals must have examination and in the pediatric departments. I think we should try for that.
Yeah, and that's something which was it was really sad to see in the film that in ancient India and in ancient cultures, it was a standard practice at birth. A midwife would check for a tongue tie. And it's just the knowledge and things that we've just lost along the way. And that's just sad. And we've got to work at going back to our basics.
But I have some
That's
theory.
right.
Yeah,
That's
exactly,
right.
yeah. But I do have a little bit of a theory around that fact that, earlier when midwives used to look for babies, and if they had a tie, they probably would use their nails to actually, remove that. But possibly they were looking at anterior tie, which is basically coming up to the tip of
Right,
the
so you
tongue,
can-
which is kind of slimy and
Right.
it's a little bit stretchy, and it's just
Easy.
avernous. Basically, there's
Right.
no vein running through that. But then if you're looking at posterior ties, like Doc was talking, it's very submucosal, it's so inside that it's not possible for you to use a nail to even identify or snip it off.
Right.
And my theory says, and I postulate this, but there's no way that I can actually find evidence to that these are probably those babies who couldn't really survive. We had
Right.
a high rate of
The high
mortality.
mortality, of course.
Perhaps those are the
Of
babies who
course.
couldn't really do anything at all,
Right. Right.
So there is a lot to it before we actually can kind of enumerate it. When we look at tongue ties, we have just 4 classifications of it. But I'm telling you, I've seen 100 different variations from class 1 to class 4.
I'm sure.
And many in between. So
Right.
there are every tongue tie looks different. And when
Right.
we're working on the table and we figure out, doctor, you can say that. It's about how deep it goes. Suddenly we realize, oh my God, this is deeper than what we thought. And we didn't know this was how it was inside, So
Right.
there are different nuances to it. And research is really, really the crucial thing here.
Right.
Education and research is very important, Preeti.
So which brings me to the penultimate question, which is, like you said at the very start, when something is, I think, purpose of your life, it finds you. You don't go and find it. It just finds you. It seeks you out and it sought you out. Your work has sought you out and has led you on a journey which you are as dumbstruck about it. And how did you land up in this place, being a filmmaker, making a film about a subject like this? So I know it's hard for you to predict what's going to happen, but seeing that this is your work now and this is where your soul is guided to, what do you see in the foreseeable future? What is it that you want to do next in this journey?
It's kind
And
of...
what can we expect from, I know you're collaborating with so many professionals around the world we've seen in the film. So there is obviously a global community around this. So what are we seeing in the world and what are we seeing in India, and where is the hope coming from?
So I think one of the things is what has happened in the rest of the many parts of the world is that they're starting to see there's a reality to this. There is something that's seriously going on here, because we are starting to see a lot of people who are coming from medicine, which is sleep medicine. In the US and in Australia, sleep medicine started to take extreme interest in understanding about tongue ties. And just understanding about birth, because that seems to impact how the airway functions throughout your lifetime, because it changes how the craniofacial development is for the baby. Because if they are not able to use all the different muscles and cranial nerves, which Zia was talking about, which is like, oh my God, there's so much going on there for this baby. And if the baby cannot exercise those muscles and move those structures through that long-term breastfeeding, you are going to have some kind of physiological impact of it. And that's got to do with your airway. So sleep apnea, SIDS, mouth breathing, snoring, these are issues that we see at later age, much later age. So they have started to become more interested in that, Preeti. So people are starting to do some research. I think that's where it's heading to. In the last 5 years, it's been, the scale has just enormously increased, the number of people who are getting interested. You have myofunctional therapists, you have, head and neck surgeons, you have sleep medicine, you have people coming from different other backgrounds who are getting interested in dentistry. I think majorly dentistry is getting really awakened to this fact that because they are working on the craniofacial structures, they are looking at these impacts that could be prevented much, much earlier rather than do repair work later.
Right.
That is so much more harder. I think doctor will be able to enumerate that. The fact that it's so much harder to work on the structures much later, and you can never really bring it back to its normal function. And that's important that we do that. So education, like I said, and it's kind of surreal for me to even begin to think that even before the film actually took shape, other projects started to also come along with it. And this is why I feel it's a universal force. I don't own it. It's just happening. I'm probably just one of the pawns just picked up from the, amongst people, and then, here, do it. That's your job, now just do it. And you're just going through it, like the do it mode, So it's starting to collaborate with other universities in the world to bring the world-class lactation education into India. And that's already soft launched, so we are going to roll on more. And me and Dr. Pradhan and other people across India will be also collaborating and also sensitizing about understanding advanced pediatric assessment for tongue ties, rehab, and it's going to be rolled out in November. And there is going to be a symposium on lactation in November as well. And there is also a one-day sensitization that a panel like this would be, like Zia and people in Delhi and other places in India will be sensitizing about the various subjects that the film deals with, just to orient parents and medical community to start to talk about these. Because you cannot deal with one subject about what's going on with this baby, because you have to be able to deal with all the layers together. Only then can we move forward. Because if you're just looking at tongue ties, you're going to have oral aversions, severe issues where babies are really traumatized. You're getting to see, Preeti, 800% increase in frenotomies in the last few years in Australia alone.
But that's dangerous too, right?
That's not okay. That's not okay. That's because we're not looking at the different layers there. Right. So you're also seeing something similar happening in US. So one of the things that the film seemed to do when we were showcasing that in the conferences was like, oh my God, there seems to be many other layers to this. Like, we need to slow down. We need to look at these nuances so that we are able to put it in right context. Right. You see, not being dismissive and being overly interventive. It's not any different from giving formula, this is just a second hand, or using a cesarean as just every other birth having a cesarean. So it will not be any different. So we need to slow down in that process.
So we're not always looking for a quick fix to every problem.
No,
right?
We cannot do that. No,
right.
That will be very, very harmful if you're working that way.
Absolutely.
Yeah.
So I think we are almost out of time.
Yes.
And what I'd love to do is just give the mic to each of the panelists for a closing comments and closing thoughts after watching the film and hearing the discussion. And also we'll pass the mic around if anybody in the audience has something to say. So a quick minute from each of you. You're done.
I'm done with everything.
Okay.
Yeah, all I can say is one has to believe in one's body and trust one's body. As someone had said in Birth India, that medicine is a few thousand years old, but a body is 1 billion years old or 1 million years old. So definitely just listen to what your body tells you. And also to have a good support system during birth and after birth is the key for a happy birth. Thank you.
I think I've said whatever had to be said, but just one point is that let us do it only when we identify a defect, and not just like, in every patient, that every baby who is born, we do not need to have to do a tongue tie. But I think, and that's very important, that we got to train, and that's where doctors like you will come into the fray, is we train the midwives, we train the nurses, because those are the ones also who will identify it in the hospitals, and you will train the neonatologists in particular, and the OBGYNs also, who can get into the act. Train them to identify that and treat only those who need it. I don't think it should be abused. I think it should be used very carefully, and when it's used carefully, we have seen the results. They are amazing.
I've already said everything, but Yasmin, that was really beautiful, very impressive. Your film is really at the threshold of big transformation. It's amazing that you guys are bringing this work into the country. You really are pioneers here, so really proud of you. Congrats, all the best.
Thank you for being a part. So we do have a mic. If anybody would like to ask a question or share any observations, we have about 5-7 minutes for that.
My name is Siraj Sayyed. I am India correspondent for filmfestivals.com. I think the most important statement made on screen was by the Brazilian lady who said that they have an act under which it is obligatory for hospitals to check for tongue ties before the mother and child are discharged. I'm sure this esteemed panel would be aiming at some such regime in India as well in the coming months, and the conference that you are talking about. And I would urge you to really push for it as hard as you can. There will be pains, just as there are labor pains, but I'm sure you'll be able to get there sooner or later.
That's a really wonderful suggestion. Thank you so much. Any more questions, observations, any?
Hi, Yasmin. Thanks so much. That was amazing. I was really lucky to do the 2-year craniosacral course organized by Zia with Yasmin, and she's the most incredible, sensitive support system. A quick thing that struck me, Zia, about what you said about the animals and how they give birth naturally. And I was just wondering how, when you gave the example also of the woman in the village having given birth and done everything herself, there is also a very high mortality rate amongst the animals when children are born due to circumstances or predators, etc. They view the death of the infant or the litter, it may be, in a very, again, in a very natural, non-emotional response, which is the non-human associated response to how humans would generally associate it with now. So I'm just wondering, when you look at the factor that there is so much fear and psychosis and the saving quality of this, to save a child like this. So how would, I'm not sort of phrasing it properly, but what would be the attitude to a child that is actually supposed to not survive a birth? And how do we tip the balance of, how does one approach those parents?
When we look at forests that have no interference from human civilization, then those forests are very well balanced, yeah? Because there is no overpopulation of any animal species in those forests. So that's about balance. I think what's happening with us, there are so many aspects in which one can answer that question, but if I look at it on a biological development of our brain, of all the mammals, the human brain, the limbic part of our brain, which is the social nervous system, is the most developed compared to all mammalian brains. And the social engagement system and the social nervous system of our brain, when it is so highly developed, it also has very high bonding, attachment, holding on. We also have a very highly developed neocortex. So if we have a problem, we have the ability to solve it. And I don't think we can answer this question in terms of, is it right, is it wrong, how to, because if we didn't have this strong attachment to save and the neocortex also working on how to, we wouldn't have all the scientific advancement that we have today. So whether it's right, wrong, where's the balance, I don't know. It is what it is right now. I can look at the good that's happening out of it and keep my focus there.
Since the mic is just so close by, I didn't want to miss the opportunity to say how tongue-tied I feel, to say what a champion filmmaker you are. I'm just taking away from the subject of all the major technology and everything that we are talking about, but I'm also deeply touched that such modern doctors are looking at ancient wisdom, who are obviously touched by technology and use it in their daily life. And of course, they are the work that you're doing. So the whole panel and the people who are here are using actually different mediums and saying the same things and coming together. And that collaboration can be so strong and powerful. So right at the start, when Preeti asked you why not a book and why a film, I think in 59 minutes, the way you had us glued to our seats and tied to our tongues. Just explains that, really speaking, it's a great message, and what a fantastic film. The editing is so sharp. So when somebody asked you, out of 200 people, have you made more films before? I mean, what are you doing? You're trying to tell us something, and what a superb medium and how well put together. So congratulations. And I hope we can all, in some way that we are here, take it forward on different platforms to bring about the awareness. So really touched. Thank you.
Thank you so much. Thank you.
I think that was a very beautiful summary of the entire evening. I couldn't have done a better job. So I'm going to leave it at that. Thank you for sharing that. A very heartfelt thank you to everybody who came here today, to everybody who supported in this evening going so smoothly. Absolute gratitude to our three wonderful panelists. Thank you for sharing so generously of your time, your wisdom, your knowledge, your experience. Really, it's a work, it's collaboration. It's when all these experts in their respective fields come together that, transformation happens in society. It's not the work of any one person, and we are very, very impressed and humbled by, the work that you all are doing. And of course, a big, big round of applause for the champion filmmaker. Might be seeing a lot more films coming out of, your production house.
Yeah, I guess it's
many more.
And there's
Please have me at all the screenings.
There has to be something about this, because recently I've realized that actually my appointments have started to come down. And I'm thinking that people think that I've already become a filmmaker and I'm out of business. So I just want to say, no, that's not where I want to go. That was one way of actually having a churning of my own experiences of life to be able to portray it. I think it's just I think it was a very personal, intimate process, and I'm glad that it was shareable. That's all I can say for that. And thank you, Isha, for being able to bring that experience alive, to be able to actually hear it from people who actually feel it, go through it, and I'm very grateful for that, Isha. Really grateful. And I'm grateful for each of you who are here, because I think each of you have had some experiences of the similar setup of body and mind and how we function. And some way it's getting attracted, that more and more tongue-tied people get attracted together somehow. So they all come together as a tribe, as a foe. Isn't it? We're all tied together, like she said. Yeah.
So, but we want to speak.
Yeah, somehow. And then and people who are not tied become tied now. So thank you so much for coming.
Can we have the four panelists at the center for our photograph?
The 2-year biodynamic craniosacral therapy course with Yasmin, who's an incredibly sensitive and intelligent therapist. I was absolutely gobsmacked by the quality of the film. I thought it was absolutely amazing, and it's made a huge impact on me personally, as well as our craniosacral community who are here. I will surely be spreading the word to pediatricians and friends around for the importance of tongue ties, and I wish her all the best for this. I think her work is revolutionary, and what Dr. Pradhan and her are doing is going to go global, and especially impact a huge number of children and parents in India.
Thank you. Okay, ready? Start.
Yasmin, it was just outstanding. I mean, I expected this because the kind of hard work and the focus and the way you do things, I mean, I knew this was going to come out, but I'm actually tongue-tied. I can't say anything more. So I'm really just all my blessings, all my love, all my everything with you. I'll be there with you always. Thank you.
Okay, start.
Hi, so I'm Zara.
And I'm Fisha.
So we wanted to share what we thought of the film.
This film was really well directed, and it was just amazing to watch.
And I watched this film in the making, and I learned a lot of stuff about everything.
When I saw it directed sometimes when I came over, but I mean I didn't know it would turn out so good. It
So
was amazing.
It was amazing, and
Yeah.
really,
Thank you.
Thank you.
Hello.